What up, what up, what up? Hey, everybody. It is Monday. It is 8:30, which means it is time for Conversations with Teresa. I'm your host, Teresa Aline. As always, I got to figure out another word, but I am excited. I am thrilled. I am pumped. I am whatever you need me to be, but I am here, present. I'm all in. And tonight, the what are we calling this? Technology is working, and we got Dr. Laura who's coming on with us tonight. Tonight we get a chance to talk about some good stuff. All right, we're gonna be talking about our stuff. We we're gonna be talking about vaginal health and UTIs and what we need to know about it. It's like these conversations that they may or may not come up in every day. I mean, when's the last time you talked to your friend about a UTI, unless you were like having one and you needed a ride to the doctor, right? Let's try to avoid all that. We're going to have Dr. Dr. Laura's here. Hey, Dr. Laura.
Hi.
Hey,
Thanks
how
for
are
having
you?
me again.
It's you again. Thank you so much for coming on. Thank you so much for being so willing and so available. We totally appreciate your insight, your wisdom, your energy, all of that stuff.
Thanks.
So we get a chance to talk about, like I said, vaginal health and UTIs as Dr. Laura and I were talking. She brought up the subject. This is something that comes to her probably not enough, but she knows that this is something that we do need to talk about, especially in this time in our lives in perimenopause. And so she has been teaching me some stuff. I'm looking forward to all the insight that you are going to give to the audience tonight. So why don't you tell us why this subject? Why are we talking about this? I thought we were just talking about perimenopause. What's up with the UTIs and the vaginal health?
Yeah, it's a great question. Again, most people think when we're thinking perimenopause, they're thinking the hot flashes. They may be thinking sleep is terrible. And the next thing is like fatigue and brain fog.
Yep.
But then we start to get out and then we don't really realize all the other symptoms. But we do notice that we're getting urinary tract infections again. Or, I mean, again, because they oftentimes happen when we're in our sexual debut and we're more active maybe in our hormonal life. But we also may notice from our moms who are getting recurrent urinary tract infections even later in life. And it becomes a major issue for people. We don't always realize that it is directly related to estrogen and maybe even our androgen levels, but definitely related to a drop in our ovarian hormones.
Wait a minute, you just brought up a word, androgen.
Oh, yeah, androgens are the male, what we typically call male hormones. So testosterone is an androgen.
Okay.
They all actually come from the same original molecule and they get transformed into estrogen, progesterone, testosterone, cholesterol, like it's other steroids. So the precursors are kind of make all the hormones very similar.
Okay.
But we do make androgens. Yep.
Okay.
Thank you for holding me to that. Yeah. So in that, our drop in our male hormones, the androgens, can also exacerbate the issue. What I want to do, well, before I turn it back to you, I think I would like to just leave the take-home points at the beginning.
Okay.
Compel people to listen, and two, so if you have to go, you get the message right away.
I like it. I like that. All right, let's do this.
So what's the most important thing that I want people to know about this? One, urinary tract infections, they recur because of drop in the hormones. They are preventable.
Amen.
They can lead to hospitalization if it's not taken care of. This condition where your vaginal health is changed, the pH changes, the all your micro biota, your flora in your vaginal canal
Yeah.
changes, the connective tissue thins out. We just dry up everything dries up. We get the wrinkles, like the dry skin, dry hair, and
Guys.
dry eyes, you name it. Right, exactly. Well, that's happening down in our genital area as well. So we now name it the genital urinary syndrome of menopause. There's actually a diagnostic name for it.
Okay.
Yeah. And it encompasses everything from vaginal dryness and pain to urinary tract infections. So I, want to let you know that this is serious. So urinary tract infections, vaginal dryness can get really serious. And it's the only thing we know for sure, maybe not the only thing, bone health is probably the other one. Genital urinary syndrome of menopause gets worse as we get older. So a lot of people will get over their hot flashes. They will, get over the brain fog and they like come out of the clouds. But if you start to get genital urinary syndrome, it is bound to get worse unless you treat it.
Okay.
And
Okay.
treating it early is important. So urinary tract infections, vaginal dryness are related to hormones.
Right.
Treat it. Don't wait.
Don't
You can
wait.
get really sick from it. So those are the take homes.
I have a question. So let's say if you're not sexually active,
Okay.
will you notice being having vaginal dryness?
Great question. Absolutely. So we interact with our genitals because of our urinary system comes through there. A lot of women, it's not you don't necessarily experience the symptoms up into the vagina. You can mostly experience the symptoms in your vulva. So the external area can get dry, itchy, burning, can hurt when you urinate. The pH of your urine can cause some stinging. So absolutely you can. Do you have to? Not necessarily. And this is important because some women will take hormones for their hot flashes and they take it systemically, either by mouth or a patch on here.
Mm-hmm.
The genital urinary syndrome is the one syndrome that absolutely needs local estrogen.
Okay.
And so when people say, I'm not sure if I need it because it seems okay right now, that may be true. It's okay now, but as soon as you start to notice something, you definitely want to get on local estrogen.
Okay. Okay. Because yeah. Well, I'm glad I asked that question because I wouldn't have. Yeah, I don't know if I would have known.
Right, because you might not know until you get 2, 3, 4 urinary tract infections if you're not sexually active.
Right.
Or you might not know until you have vaginal prolapse because everything thins out. You can get your pelvic organs drop through your vagina.
Wait,
That
wait, no. Wait, what'd you
okay.
just say?
Oh boy. So yes, another thing we don't talk about is our uterus falling out.
Oh, come on. No.
It
No.
can. It can.
No. No.
And no, I know. And I think people are they carry so much shame and embarrassment and also quite frankly pain that they don't talk about it enough. But women the world over are dropping their uteruses through their vagina. Their vagina can just drop down. Their rectum can drop into it. It can make it hard for them to go to the bathroom.
I don't understand what you're saying.
Yeah, everything
I don't understand this concept.
I know. Okay.
I don't know what I can't I can't picture this.
Yeah, it's hard to picture. Well, if you imagine your genital urinary area, like your vulva, your rectum,
Yeah.
getting like kind of the pressure dropping it down because the muscles of your pelvic floor are not holding it up. They're getting weaker and your connective tissue is getting weaker. And so the things just sort of, and they can dip down. And when those organs, this inside of your vagina dips down outside of the vulva, it's very, very painful. It's really painful. Yes, it can
I
happen.
I I I need a visual. Not right now. I'm gonna have to
Okay.
go back because I can't. I
It's hard to imagine, but it's like, hmm.
like it makes sense as you're talking about, like the muscles and their weekend and things like that. But I'm just like, what do you mean fall out? Like, do you legit
Well, it
like
doesn't like fall on the ground.
right?
Still attached,
But
but it dips down and there's varying degrees of it. And so your OBGYN can take a look, examine you and tell the degree of it. So they'll have you like bear down or cough or push, and that you can see your vagina come down. You can see the cervix sometimes come down. Some
wow.
people don't even have to. Some people you can't tell unless they're standing up, so you have to examine them while they're standing up. But yeah, this is part of not tending to that area.
Okay, so
Women get surgeries to try and pull this all back together, or they wear a pessary. Have you heard of pessaries before? So a pessary is like a rigid ring that you have an OBGYN insert up into your vagina, and it kind of pops around your cervix, and it's like expanded, and it will hold up your organ because it will sit like on your pelvic bone so it can't drop down. And you have to go in and get it taken out and cleaned and put back in every 3 months. Women do this. Older women, especially.
so if anyone's looking and I'm not laughing, I am just astounded. Like I'm like, what?
Okay, I know you and I didn't really talk about that part of it.
We did not talk. This was not
I mean,
part of our pre-meeting.
no, rarely am I getting there, because when I'm talking to people, I'm catching them when they're having vaginal dryness and pain and itching and burning and a urinary tract infection. So we get them on the treatment right away. And so I'm not seeing at this point right now people who are presenting that way because they end up going to the OBGYN. Pass, go, you're like, you've missed the boat.
Yeah.
I'm there to try and get all these people before the boat comes into dock.
So, we talked, I think in general, or maybe not in general, but like after you have babies, and like the muscles, and making sure that you're having I don't know the medical term, but like you're exercising.
Yep,
You're
because of
exercising.
urinary incontinence, like you cough and sneeze and it gets hard
Right.
to hold your urine.
And so, but I've never talked about this stuff like that. I, you know what I mean? I'm like, oh yeah, I don't want to, I probably want to be able to laugh or cough, without peeing on myself. Okay, so I'll do these exercises. But one, I didn't talk about it a lot. I feel like it was just a couple of times. She's like, oh yeah, just make sure that you're doing your exercises. Okay. And then it's like 2 years later. I'm like, oh yeah, I think I was supposed to be doing something, and
Yeah.
then it happens, right? And then it's like, 15, 20 years later, and you laugh, and then it's just like, oh, I should have been doing those exercises.
Yeah.
But anyway, okay.
That's just those are the like the canary in the coal mine. Like you start losing control of your sphincter, and the next, it can get worse. And then the next thing you know, that all your pelvic organs are getting lax.
Okay. Obviously, there's another show that's coming
I know,
out.
right? We need to talk about Kegels because, people might know the word, but they don't do it, or they do it, but they don't do it right, or they do it right, but they don't do it enough. And
Right. Yeah. Yeah. And
come to
it's
find out, we have two pelvic diaphragms. We have the external and the internal, and it's a battle between the two. And you want to contract one and not the other one. You want to relax one and not the other one. So it's, there's a whole branch of physical therapists who do just pelvic floor, and
wow.
they're all up in your business,
Well, yeah, they have to be. They have to
trying
be.
to figure it out and helping guide you. It's not something you can just, your primary care doctor can say, go do Kegels. You'll be, done. What else? I don't have time to tell you anything more.
Wow. Okay, so note to us. We're gonna have to figure out how to bring this onto the show to show people how, or I don't know.
Sure.
Yeah, we're
Yeah,
gonna
I
have to
can do
figure it out.
that. I can get some infographics.
Yeah, because that's important. Okay, so when should we again so I hear this conversation after the babies. When should we be talking about this? When should we be putting these things? Because we talked about how at the beginning you talked about how this is preventative. The UTIs are preventative and different things. I know we kind of morph into things, but when should we?
That's a great question.
Yeah.
So a lot of when you go to your OBGYN postpartum, they'll tell you Kegels. And maybe that's important to be talking about at that point. But you have a new baby, and I think it adds in a way. I think women figure it out on their own, that they are caring for another human being, and they don't get time for that. Nobody gets time for that.
Ain't nobody got time for that.
Yeah, ain't nobody get time for that. And if they do, because you're breastfeeding and you're like, okay, might as well do them now. It's hard to really do them right, but that may or may not solve the problem in the short run. It's later on when you actually lose your estrogen, because postpartum, you're going to get your hormones back in place, and they're really good at rebuilding and getting things back in shape again. If you do some of those bare minimum exercises.
Okay.
People, depending on their birth, though, it may have more of an impact. And I would not hesitate, if you try and you feel like you have time, asking for a referral to a pelvic floor PT. It's like good hygiene. I mean, come on. It's probably more important, honest to God, than going to the dental hygienist. And I don't want to throw shade on the dental hygienist, but they certainly have. The dentists have they have figured out how to get in our lives twice a year routinely, and we feel shame if we don't
You got that.
do it.
Yeah.
We need to do that with a physical therapist for our pelvic floor.
Come on now. I like that. I like that. They figured out how to get in our lives twice a year. Surely we can have at least once a year.
Yeah. I mean, if I could say, if I brush my teeth twice a day and floss every day, do I need to go to the dental hygienist? But that pelvic floor PT would really make a difference. Really
Okay.
make a difference.
And unfortunately, we need that referral of the thing that we don't talk about enough.
I know. Well, your doctors should be open to it. That they're good at referring to PT. They're good at that. And you know what? There's some PTs who are out of network anyways that you don't need a referral for.
Okay.
Just Google it.
Yeah. And again, I think one of the things I love about talking about all this is because there's just stuff that I learned stuff all the time. Like it's this continual reminding. Again, here's this conversation that I'm sure that I had. I know that I had because it's not totally unfamiliar, but when's the last time I did that exercise? I don't know. Right. And so when's the last time I talked about UTI?
But you brushed your teeth.
But I brushed my teeth. Well, did I do that? No, I did do it today.
If you maybe do your Kegels while you're brushing your teeth. I don't
know. No, literally. No, that would make a lot of sense. Okay. So UTIs. I don't think we have. Do we ever even explain what a UTI is?
Oh, sure. Let's talk about that. That's great. So there's a couple of mind-blowing things that I'll just start with. First of all,
more mind-blowing.
I know.
Oh my gosh, Laura. Okay, I'm ready. I'm ready for this.
Hang with me here.
All right.
We are made up of more microbial cells than human cells. That is crazy. We are made up of microbes, bacteria, fungi, yeast, viruses. That's the glue and that actually is what it's this very symbiotic relationship. Like they need us to fuel the whole system and we need them for all of the mechanisms. Like they help us break down things and build up things and do all the things. So we have bacteria throughout our flora, our microbiome, if you were, throughout all over the place, on our skin, in our vagina, in addition to in our brain and in our gut. In our vagina, that microbiome, there's bacteria that exists there. Some of it is just hanging out. It's not a problem until something happens. So what happens? When is that bacteria can get overgrown? Stresses on the body. And what could that be? It could be dehydration. It could be lack of sleep. It could be emotional stress. It could be just the stress of sexual encounters. It could be frequently going to the bathroom, douching, using like dyed and perfumed toilet paper, wearing or using dryer sheets or laundry detergents that have a whole bunch of chemicals in them. All of these things can stress out the local vaginal flora and cause an imbalance. And when that imbalance happens, the pH of your vagina changes, and some bacteria will now have preferential, they exist better in that situation. There are a handful of them. The most common one that most people know is E. coli. So most UTIs, I'd say, or when I say most, I mean, probably more than half, but are from E. coli. It adheres really well to our short urethra and it gets right up there if we need to. But they're not infections that are like, you're not dirty. Like people are like, oh, I better douche. I better use like really strong soap and, all this stuff like that.
Yeah.
That's not typically what's going on there. It's your own vaginal health, pH, your microbiome, the thinness of things. If things are thin and they can adhere really easily to the lining of your urethra and get up into your bladder.
Okay.
So basically a UTI is a urinary tract, anywhere from the urethra to the bladder to your ureters that connect your kidneys, deliver urine from your kidneys down. Anywhere along that is considered urinary tract. And that's if you get an imbalance of your microbiome with some pathogens that can become dominant and overtake and cause an infection.
Okay. You had me at dryer sheets because I love the way they smell.
Yeah.
And I'm like, there's just it's just like everything.
It is everything.
It's everything. Oh my gosh.
Yeah, I know. And all the don't even get me started with organic, and by organic, I don't mean fancy organic, but like cotton is good. Wool is good. Not that you want to wear wool underwear, but wearing all this spandex and nylon and
Yeah.
whatnot
Yeah.
right up against there can cause problems. I know. And then your laundry detergent in your dryer sheets.
Yeah.
So I would say if you want a way out of the dryer sheet situation and you really like the smell, get a wool dryer ball or several and essential oils.
Right.
You could try
Yeah.
it.
Yeah.
It's
No.
never going to be as good, but I'll tell you, my family has, well, a couple people in my family have decided they can never go back to not using natural detergent. I make detergent out of soap and salt and baking soda, and
Okay.
our clothes don't smell like anything. Like they don't smell like like any sort of
Perfume or
perfume, and they also don't smell like BO. They're like super soft and fluffy and clean and no smell. And you have to get used to that because you're
yeah.
like, wait a minute, I don't know if this is clean or not. I can't tell by smelling it, but it just doesn't smell. Even though I use lavender soap and lavender whatever on my dryer balls.
Mhm.
But anyways, it takes a while. It's not for everybody.
Right, right. Okay. Okay. All right. My mind just it's been blown a couple of different times, but that's okay. That's what we're here to talk about. We're here to talk about all these.
I know there's more than I realized that we were going to talk about.
It's so much, but I'm really happy. I'm happy to have this conversation and just to know because there's so many questions, right? Because you don't know. You're just like, is that something? Do I have a scratch or is this something more? Is this a smell because my bathroom smells? Is this me? I didn't smell it yesterday, but I smell it today, but I didn't smell it. Like there's so many questions and we
Right.
don't know when to react. We don't know when should we call a doctor. And then unfortunately, when we do, it's usually pretty bad.
It can, yes. I mean, this is very true. So about 1 to 3 in 4 women will have genitourinary syndrome of menopause, and maybe 1/10 of them will present it to bring it up with their doctors.
Why do you think that is?
Well, they don't know it's related. They feel shame. They feel dirty. They feel like they haven't been caring for themselves well enough.
Hmm.
They are. It's hard to talk about your private area
Yeah.
with physicians, or doctors or your
Hmm.
provider. Yeah, I think it's not. We just haven't made normalized it.
Okay. Okay. And I'm definitely not talking about this with my friends.
Mm.
Like it's not, just kind of, I don't know if it's because I'm not thinking that they're going to have an answer for me.
Right. Well, I mean, okay. Well, imagine this though. Also, like, I'm just thinking right now, would I ever say, does your vagina smell different?
Right.
I mean, I don't know if I'd say that to my friends.
Right.
Or do you
Exactly.
feel like you have little tiny razor blade cuts on your vagina when you wipe yourself? Like it's so painful.
Yeah.
I
Yeah.
mean, it is even, and I'm free to say, I say all things at the dinner table with my kids, but I'm not so sure I'm going to really get down and dirty even with my friends.
Exactly.
I
Exactly.
still am like, what if they say no? Or, I don't know. And they're like, "That's
Right. Like,
weird."
what's wrong with you? And it's just like, no, it's not. But
Yeah.
yeah, I don't, and I know for me, like, I just don't know enough about it to question. Right.
Yeah.
Oh my gosh.
Especially the smell is one. Like microbiome changes when we don't have estrogen. When that goes down, our microbiome changes everywhere. So our body odor will change,
Mm.
our discharge will change, the smell of our discharge will change.
Yeah.
Um,
Yeah.
your mouth, like your breath, can change. I mean, I even noticed kissing my husband when I'm like, it's funny, I don't recognize your microbiome anymore. You're just, I kiss you and you taste, it just feels
Mhm.
different. You're like, wow, we're getting old. I feel like that old microbiome. I'm like, oh my God. I don't
Oh,
even remember grandma, but my grandma did. So that happens, but we don't talk about it.
no, no.
So it's happening to all of us, but we are like a kind of embarrassed about it.
Yeah, yeah. Embarrassed and ignorant in the sense of, again, we don't even know. I don't have the questions to ask, you know.
Yeah. You don't
So,
even know what you don't know.
right, exactly, exactly. Okay, all
Some
right,
of us think that you're having urinary tract infections. That's just a part of life.
right, right. I know there's a commercial where this woman is like, me and my partner, we were having UTIs, and then I don't know, it's some drink or something. I forget. All right. I'm not making it up, but
No, no, no. I'm sure there
um,
are ways to change the pH of your urine that can help with that. I don't know what specifically one you're talking about, but people can take, like, D-mannose is another one that is sort of a pre-antibiotic. You take it to keep your vaginal health good. But really, as we get older, if we're talking perimenopause,
mhm.
estrogen, because even if you
Estrogen's
were
it.
your pelvic floor PT, nothing you do will change your connective tissue strength and thickness. Nothing you can do is that with the PT is going, or your Kegels are going to change your vaginal flora. None of that's going to change the pH. I mean, you can try and change it with all sorts of other stuff, but the estrogen will do it all.
Mm.
Local estrogen is just, everybody should get one, a tube of it.
I
Like,
love it.
welcome to being perimenopause. When you're advanced maternal age, you go to your OBGYN, they should say, here's your vaginal estrogen cream.
That's
This
what
is
they
your new friend for the rest of your life. Don't
and
leave home without it.
listen. And why would you want to? That's good stuff. Okay, there's my mind is just going, and I'm just like, okay, I know it's 9 o'clock. Um, Got to bring it in for a landing. What do you want to leave us with? I know you started off with what you wanted to leave us with. Do you want to reiterate that or anything else you might want to add?
Well, I guess we didn't get to how to do it, and that actually matters because most people will tell you you get this tube of cream and you get a syringe sort of, and you draw up a whole bunch of cream and then you squirt it into your vagina as high up as you can and hope that it all gets absorbed at night before you go to bed. And when you wake up in the morning, you find out that a whole bunch came out or didn't or whatever, or
It's
just
like when you have a yeast infection.
yeah,
And
exactly. Oh, yeah. You're like, wait a minute. Oh my gosh, I have a yeast infection. We're like, oh, right. It's the estrogen cream. What you should do, this is what I want to leave you with. Everybody's going to, not everybody, but most women will need this at some point in their life.
okay.
Get your vaginal estrogen cream, put it on your fingers, rub it all over your vulva, your external genitalia, and anywhere that has symptoms, cuts, scrapes, itchiness, whatever,
Mhm.
rub it all in. And then the opening of your vagina, you can go up a little bit, but you don't need to stick all that cream up there. Just rub it in like you're putting, I call it your bottom face, like you're putting moisturizer on your face, rub it in, top face, bottom face. That's my advice.
I love it. I love it. Great advice. So, if you didn't know, now you know. Get yourself a big tube of vaginal cream, but you only put it on a little finger.
Yep. Yeah. Don't do
Stop
the whole mess.
the
Yeah.
I
Oh
love
my
it.
gosh.
So listen, we're gonna have you back on again. I can't wait to see what we're gonna talk about because I again mind blown. I'm like, no, I need you to stay up there.
Oh,
Don't fall down. And I'm laughing, but I'm like, oh my gosh, this is real stuff.
Oh, you're going to Google things you wish you never did because you'll see things you wish you never did. But it's good. It's all good.
It's all good. It's all good. All right. Well, thank you so
So great
much
to
for being
talk
on. I wish that you were in Boston because I would love to have you. I have an event this Thursday, and it's called Thrive Through Perimenopause. And it's going to be a fun, interactive conversation that we're going to have with people who, whether they don't even know about perimenopause, whether they're going through it, maybe they are postmenopausal, but we're going to be talking about us. We're going to be talking about just this phase in our life that can kind of take over at some point, but how we don't have to let it run us. We're going to thrive through this time because there are ways to thrive through it. We don't have to just kind of let things happen. And one of those things, as you were talking about, is this estrogen. So I'm really looking forward to this Thursday, the 31st. It is going to be from 6 to 7:30. It's going to be at the Wellness Center in Stop and Shop in Grove Hall, and it is Thrive Through Perimenopause. And you can even go to thrivethroughperimenopause.com to sign up and to register. It's a free event, but I'd like to know who's coming, who the audience is, and you can check out this flyer that's on the screen now. There's a QR code. But again, I was saying that I wish that you were here because, man, there's going to be some things that you'd bring up and people be like, wait, what? So somehow we're going to do something together. I'm coming up there. You're going to come down here. We're going to do some stuff. We're going to have a fun time.
Sounds awesome. I'll get all my little visuals out.
Yes, that's going to be a great time. But at any rate, thank you so much. I look forward to the next time that you're on. We'll come back and talk about that. And in the meantime, to the audience, thank you guys so much for tuning in because you are amazing. I also want to make sure that you guys know where you can find Dr. Laura. All right. So Dr. Laura, she has an amazing practice where she is our menopause guru. She is a menopause specialist. And you can go to, reclaimmenopause.com is where you can find her website. You can find her page and all the information about her. And if you're in the Maine area, you can go and check her out as well. So very much looking forward to our paths continuing to cross. And you keep doing what you're doing. I'm gonna keep doing what we're doing. We're gonna help people to thrive through this time, through this midlife time in life, men and women, because we all need to know. So I love it.
Your community is so lucky to have you. I wish you the best on Thursday. Maybe I'll poke my head in if I can.
I would love that. I'd be like, you'll blow my mind again. We'll work it out. All right. Well, until then, have an incredible rest of your Monday evening. For those who are watching, right back at you. Have a great Monday evening. I look forward to talking with you more, but seeing you on Thursday. And then, of course, next Monday, right back here at Conversations with Teresa. Have a great night.
Thanks, Teresa. Take care.
All right. Bye-bye.